And in tonight's 9 p.m. Extra, do you know your oral DNA? Find out next. It's a tool police have been using for a long time to solve murder mysteries, but now dentists are using it to solve the mysteries inside our mouths. In tonight's 9 p.m. Extra, Carrie Pena tells us about oral DNA.
I've always had a pretty healthy oral exam throughout my life.
But a year ago, everything changed for Fred DeQuatro. He was diagnosed with the early signs of periodontal disease, and as a result, his gums were starting to bleed a lot more.
At that point in time, I wanted to get it under control.
So Fred did something most of us wouldn't have thought to do. He got his DNA tested. His dentist, Alison Schwartz with Healthy Smiles Dentistry, was the one who told Fred his own DNA might hold the answer to his problems. Fred underwent 2 new diagnostic tests designed by a company called Oral DNA Labs.
Those tests are basically collecting saliva from a patient, and that will allow us to find out what type of bacteria are alive in their mouth and how to eliminate it. And then it also allows us to find out if somebody is genetically predisposed to having gum disease.
The saliva test only takes a few seconds. It's then shipped off to the lab, and 3 weeks later, you get the results.
We actually found out that he was genetically predisposed to having gum disease. This is information that we've never had access to, and now when you go to the dentist and you have been given this information, you know that it's not because you're not brushing or flossing. It's something else.
Dr. Schwartz says DNA tests are not only helping her give the right diagnoses, it also gives her a peek into the future.
If you catch these type of diseases early, very inexpensive to treat, more predictable outcome, and you don't suffer the pain.
As for Fred, he can't believe his own DNA actually helped him get his teeth back on the right track.
Nobody wants to have declining health. And when you begin to start having declining health, I think most people want to know what it is that's wrong with you and then go into treatment from there.